CBS News medical contributor Dr. David Agus joins us now to talk about all this. Dr. Agus, good morning. Good to see you.
Hey, Vlad. Good morning. Happy Thanksgiving.
Happy Thanksgiving to you. So millions of Americans traveled for the holidays. They gathered with their loved ones. Now they're traveling back home. So what kinds of precautions should they be thinking about as they head home?
Well, you know, every holiday to date during this pandemic, 10 or so days after the holiday, there's been a dramatic increase in cases in the United States. And it will certainly happen with this one. Going into this one, we had record numbers. Prior ones, we had lower numbers and there was still spread. So the more virus you have going in, the more there will be going out, obviously. So you know your risk. If you had that wayward cousin who goes out all the time or the uncle who doesn't stay home, you've potentially been exposed and you need to go home. And what we now say, the CDC, is, 14 days is optimal for quarantine. 7 to 10 days with the test at the end is acceptable now. And so you need to assess your own risk. If it was just you and grandma, you probably don't need to do anything. But we really don't want you going back to where you were and spreading the virus.
Let's talk about children and older students. They're headed back to school. What kind of precautions should they be thinking about? What should parents know?
Well, schools are obviously a vector, is that no matter how you try and you put pods, where kids interact only with their pods, but they're going to be interactions at school. So if your child was potentially exposed or higher risk, you need to really impress upon him or her the role of quarantine. And when they get to school, to make sure that they interact with their pod only and not, a broad section of school, whether it's a university, at schools, make sure they wear masks and everyone else wear masks. The public health rules we all know now. We just have to enforce them. As we get closer to a vaccine, the more we enforce them, the more lives that are going to be saved.
And that is the most important thing. As you know, today is Black Friday. Typically, that means huge crowds. I'm guessing your advice is, look, you wanted to get together with your family. That is understandable on some level, but stay away from the shop, stay away from the crowds. Online shopping is the way to go.
Oh, yeah, there's this new thing called the internet. It is amazing. And certainly, the more you shop online, the safer you are. If you want to support a local store that does not have online shopping, call ahead and know what you want and have them deliver it curbside. Open the back window of your car and have them place it inside where you do the transaction over the phone. We all just have to be as safe as possible. And the more we limit risk, the better we're all going to do. And hopefully there's light at the end of the tunnel again. Vaccines are coming, so please behave today so we can all be healthy tomorrow.
And finally, Doctor, hospitalizations hit record levels in the United States. We are anticipating a post-Thanksgiving surge. It's got a lot of people worried. Are you worried about that? And what could the numbers look like in 2 weeks?
Well, I am very, very worried that we're going to see a dramatic increase in hospitalizations and deaths from this virus, unfortunately. And it's going to be 10 to 14 days now, the hospitalization, and about a week lag when we start to see the increase in deaths. And we've seen that with every other holiday. So, I'm saddened in many respects because we're nearing the end, and I know COVID fatigue, unfortunately, is going to take significantly more lives. When you look at the hospitalization levels we have now, and you look at the suffering now of patients in the hospital, it's only going to get worse, unfortunately.
All right, Dr. David Agus, here's hoping that it doesn't, but the numbers are what they are. They are very stark. We appreciate your time, doctor. Thank you.